So my name is Addie Helmers, and I went to Colorado State and I got my bachelor's in science of biomedical science. I'm originally from Austin, Texas, though. Moved back here after I graduated, and excited to be back here in Austin. I got into andrology. My first job was actually a biotech company here in Austin. I worked there for a few months. However, I had always had an interest in reproductive biology through my coursework at school, and through some connections got here and got my foot in the door, which is what I was always aspiring to do. I think my favorite part of the job is just the teamwork atmosphere that we have here. The lab works so great together and it makes it a really fun environment and makes collaborating on interesting cases that we have a lot more fun, and it helps not only me as a person grow, but helps us all work together and learn new things. I would like to aspire to be an embryologist. I'm already kind of working in the lab, helping them out, not only with charts and setup, but doing dishes, which is a lot of fun. I'm kind of getting my foot in the door here, so hopefully I'd like to be in here in the next couple years or so. As far as collaboration, our lab works together very well. You know, certain issues come up within the lab, or we're just not sure about certain things. There's not a single person you can't go to in the lab without asking for help. If you have a question, you're confused. We had a really interesting case where the sperm they lacked an acrosome cap and the sperm heads were extremely round, and it was just like a very unique thing that we hadn't seen before, and it turned into a big discussion about this is sort of reason why these patients probably aren't getting pregnant, but we can help them with that. So it's kind of a really cool thing to do and see everyone come together and talk about that case in particular. On my end as an andrologist, I do handle patient check-ins, so I do handle patients when they're coming through to drop off their sample. I also take phone calls if they have andrology-related questions. So if they have specific questions about their semen analysis or anti-sperm antibody testing, I do answer those questions, but I wouldn't say I have as much patient interaction as the embryologists do. So to be an embryologist in this lab, I'd say it takes a few years of training and schooling as well. You have to learn not only the andrology side of things, but also the embryology side. That comes with egg freezing and thawing, embryo freezing and thawing, as well as ICSI, embryo biopsy, all of which come later. So an andrologist is someone who handles sperm. So we're doing all of the semen analysis, anti-sperm antibody testing, the IUI preps or intrauterine insemination preps of the sperm. Basically just handling all of the diagnostic side of sperm prep. So for semen analysis, we're looking at the sperm, not only the count, but we're looking at the motility and the morphology. So sperm should be moving, so we look at how many of the total population of the sperm are moving, so we get a motility percentage. The other number is the morphology. So morphology is the shape of the sperm. We're looking at the head, midpiece, and tail, so we don't want broken tails or abnormally shaped midpieces. We want the heads to be a nice sort of almond shape with an acrosome cap, which is necessary for fertilization to occur. So the acrosome cap is a cap on the sperm that contains enzymes that help break down the zona or the shell on the egg so that the sperm can actually get into the egg to fertilize. So there is a time frame in order to complete a semen analysis. We ask that patients bring their sample in within an hour of collection. And then at that point, we then try to get the analysis done as quickly as possible because we don't want the sperm to be sitting for too long and we want to have as accurate results as possible. So the information from a semen analysis gets printed on a formal report. So we have all of the numbers listed with the volume, so how much sample was actually there, the concentration, the motility, morphology, it's all listed in a report. And then these numbers are highlighted in red if they come back as abnormal. So patients who are reading the report, who might not necessarily know exactly what all the numbers are, can kind of understand that maybe these numbers are slightly lower than the values that we are looking for.